right, so let's get down to business. This
Dude,
is my co-host Troy.
Let's do it.
This is the Bro Show. This is Troy Sears, local lender.
Hi, Troy.
Hi, nice to meet you, Vivian.
Nice
Today-
to meet you too. I see you all the time. I feel like when people talk to me and say I feel like I'm talking to a celebrity, I feel the same way with you guys now. I'm like, ooh.
So she helps men with hormone therapy.
Oh,
I am a patient, as you know. I am on TRT, and I'm about to start a few peptides to get going.
what's TRT for the listeners?
Testosterone
Oh,
replacement
okay.
therapy.
Nice.
Right? Start Strong, right? Strong 26.
Yeah,
What is it?
Start Strong series.
Start Strong series.
Yep.
I love
And
it.
So for men getting up there, not that we're getting up there in age, but like, hey, look, we just had Kaga talking about the skin.
Mm-hmm.
We're talking about hormones.
Yep.
We're talking about injuries.
Yep.
We're talking about like, look, you know, with the lunch break, that's good for your soul, right?
Mhm.
Giving back is good for
It's
your
all
soul.
mental.
Okay?
Yep.
So I wanted to do like a Strong 26 where I bring in some of my most trusted people that I use myself,
His
to
medical team.
my medical team, to come in and just help people walk through a Strong 26 because in my opinion, and I am Eat Clean Bro and I sell healthy meals and I know that they work. I mean, I've been doing this shit 20 years. I've helped thousands of people lose weight. But for those of you who are trying to really like hit the fucking gas, like
Mhm.
these are the people to call, right?
Yeah.
Like we had Hassan for the spine.
Yep.
We had Vinay, he's like the orthopedic surgeon. Like we had doctors on who have like, hey, look, fucking injuries happen. Go to these guys. You want to level up your face.
Yeah.
You want to, you
We're
know.
getting older.
So
We need to keep up with our bodies and our minds. That's it.
But I think what I want to hit home with you guys too is that testosterone is not just for gains in the gym. Like I can get rid of your prediabetes. I can get rid of your high blood pressure. I can get rid of your high cholesterol. I can get rid of your arthritis. I can decrease any issues you're having with your autoimmune disease. I can help your sleep. I can give you sexual function back. I can do all of these things and get you off your medications
Mhm.
and get rid of your body fat as well. I can get rid of your brain fog. I can make you help make more money. Like these are the things men tell me within 4 to 6 months of starting a little bit of testosterone. Look at your face. I just hit the nerve with you.
Check mark,
Yeah.
check mark, check mark, check mark.
Right,
I was like,
correct.
okay, what do I have to do?
yeah, we have to put it in your
So
shoulder.
that's
What do
really
you
what I
mean?
want to drive home. And
Yeah.
guys, it's funny. Today couldn't have been a better day because yesterday all of the big wigs in the testosterone replacement therapy world actually went up against the FDA to reclassify testosterone, talk about some of the stigma and the studies they've shown in the last 15 years about now that like testosterone replacement therapy has increased, prostate cancer has actually come down.
Oh, wow.
That's cool.
Yeah.
Huh.
And I mean, even with me coming from the hospital, I worked in the hospital for 15 years, mainly in open heart surgery. All my patients were so sick. And I think back, I'm like, if half those guys had started testosterone replacement therapy, I bet you none of them would have been here.
Yeah, and I would like to add, when I say blanketed health advice is dangerous, one of the things, like, I had a unfortunate circumstance with construction. I had a ton of financial stress. I was in a pissed off mood, and my buddy, like bro science, he's like, yo, you should take some DHEA. You're probably low.
Mm-hmm.
And I did, and don't do that.
Okay.
Listen to the
Listen to the
professional.
professional. Yes.
Yeah, like don't like, you know, your boy's a juice head and he's trying to give you some advice. Don't do that because
Please don't go on ChatGPT.
Yeah.
Please.
No, I don't know if ChatGPT would be giving the same advice I'm giving now to like go to a medical professional and don't listen to your friends on like over the counter vitamins.
Mhm.
A DHEA is actually a prescription in Europe, right? Is that? Am I going off the handle now with
Asking the
weird
wrong-
facts?
It
Yeah.
is.
It is, right? DHEA, you got to
vitamin
be
here.
careful. And then another thing, I'm like stealing your spotlight, but
Yeah.
some guys like the side effects, right? Some guys, the cookie cutter programs, like 1 shot a week,
Mm-hmm.
200, right? Give us the
Please,
rundown.
So
Yeah, come on.
antiquated.
Well,
And then your
I need to
testosterone
break
spikes
yours.
and then it crashes.
Yeah, but let's say you gave me the list of stuff, and I was like, oh, a couple of those things hit home. So if I'm interested in TRT, right? That's what it is.
Yeah.
What's the procedure? You get your blood work done first, and then you look at the blood work. Like, tell me if I'm a new patient. I'm like, okay, let's do this. 2026, I want to get my testosterone
Yeah.
up,
Let's do it.
right?
Yes.
Yeah.
So you'd either sign up to be an in-house patient. You can come see me in the office, just like a regular old doctor's appointment, or you can schedule something over the phone. We do treat all 50 states as long as you have a telephone and access to email. So that's everybody. And then we would send you, if you came into the office, you do your blood work in the office. Or if you were out of state, I'd send you a prescription for LabCorp. You go get your blood work done. You're going to fill out an intake form. You know, when you go to the doctor's office, they give you that big clipboard. You got to fill the whole thing out.
Yep.
Same thing with me. This is a doctor's office. You're having an initial consultation with a doctor.
Mm-hmm.
And we go, you know, I'll take a look at that, go over some past medical history. You kind of tell me what's going on, what you're feeling, and then I'll, we go over your blood work. We come up with a plan. You sign consent forms. I send your prescription into the pharmacy, and then the pharmacy mails everything to your house. You get about anywhere from 3 to 4 months worth of medication, depending on what the dose is. And then in 2 months, everybody gets a follow-up. Takes about a month to pull you out of the ditch and hose you off. And then after you're nice and clean, we let you walk around like that for another month to see how you're doing. And then when I speak to you again in 2 months, the first thing I ask you when I get you on the phone is, how do you feel?
Yeah.
So many doctors, when they treat testosterone, they look at the number. They're like, oh, you're in range, you're fine. Yet PS, that range is the range of men that don't feel well. Doctors don't do a baseline testosterone test, which is what Dr. Morgenthaler from Harvard yesterday was speaking about in front of the FDA. Men that beg for their testosterone to be checked, either your doctor will say, no, you don't need that. No, you're not old enough. You need to sleep more. You're too stressed. You need to lose weight. Yeah, PS, you can't do that if your testosterone's low. You can't
that
lose
makes
weight.
sense.
You can't
Yeah,
lose.
yeah,
Yeah,
yeah.
you can't lose the belly fat. So when you get your testosterone checked when you're 40 or 35, you're already on the downslope. I don't know what you were when you were 18, 21, 25, when you were going through walls, So like, that's why we always say it depends on how you feel, but really the range that I look for is somewhere in the range of 700 to 1200 nanograms per deciliter. And most of my guys are in the 200 to 300 range. I've even seen lower.
Gotcha.
That's lower than females.
Yeah. But like, so you say you get your prescription. So it's needle?
Correct. Insulin needle.
So I got to do it myself?
Half-inch long.
Yeah.
Yes. We send you a video that shows you how to do it. Or if you come into the office, I'll teach you how to do it.
A video?
Yeah,
It's easy.
yeah.
Yeah, it's easy.
I'll tell you, if you hold it tight like a pencil,
Yeah.
you can get it in there. I feel like if you don't, you got to hold that fucker tight.
Where do you put it?
I put it in my shoulder, dude. Just,
Yeah.
So you can go shoulder,
Yeah.
hip, or high butt.
Yeah.
High
No
butt?
legs.
Hold
And
it.
most people do it themselves?
Everyone.
Yeah, I mean,
yeah.
some
It's
of
an
them,
insulin
they'll have their
needle, dude.
wives do it, or,
Okay,
their
no.
daughter's a nurse or something.
I never did this stuff. I don't know.
You want all the tips and tricks? You want to know what the pros are doing? The pros are doing this shit, man.
And it starts with the blood work.
Starts with the blood
Yes,
work.
has to be continuously. And we always do blood work 2 months later, depending on what you tell me at the 2-month mark. Then we'll either go out 3 months or 4 months. Typically, it's 3 months if I need to change your dose based on what you say, based on what I see. Once we get you to a place where you're happy, then we always do blood work twice a year. We're always going to keep an eye on you once every 6 months. However, a lot of men think this is in replace of going to primary care. I can do primary care. I can do anything in the adult population, but I don't. You still need to go to the doctor and have your cholesterol checked, your kidneys checked, your electrolytes checked, your regular once a year
Physical.
blood
Yeah.
work needs to still be done.
And where are you located?
We're in Mountain Lakes, New Jersey. But again, I'm in all 50 states as long as you have a telephone and access to email. So I can be everywhere.
It's a medical purpose, right? Like,
Mhm.
obviously, testosterone has a, I don't know, from like the 80s, even though those movies were awesome.
Yeah.
Stallone,
Mhm.
Schwarzenegger, man, these guys are juiced up.
Yeah,
man.
They weren't doing
Action stars.
testosterone.
You
They were
want to be
doing
within, like,
a lot of other things.
you want to be within a normal range, and you don't want high testosterone because
Mhm.
high testosterone, dude, just as bad as low testosterone. You just want a medical therapeutic dose
Mm-hmm.
to just keep you where you're at, and that's it. It's great.
For guys that, like, let's say you're on blood pressure medication, I'll say, keep an eye on your blood pressure. It's going to start to come down. If your blood pressure is high, if your blood pressure is low and you're on high blood pressure medicine, it's going to make you tired. You're going to feel like garbage. Go get your cholesterol checked in another 6 months. There's a good chance you're going to be able to cut back on that statin or maybe get off of it altogether. And then the prediabetes that everybody has right now, that goes away too. And this is good enough most of the time.
Mm-hmm.
I don't want you to go, listen, if you want, you get what you give with testosterone. That's the wonderful thing about it. So if you want to go on a meal plan and hire a coach and, get up at 5 a.m. and weigh all your meals and get a Hume scale and hold on to it and see where your, all that stuff is, that's great. But if you clean up your diet, try and work out a little bit more, drink some more water, cut back on the drinking to maybe once a week, it's a home run.
What about women? Do women do this? Or a little bit, or it's not common?
They do.
They do?
It's not FDA approved. It's
Oh.
life changing. But again, this is the genie we're never going to be able to put back in the bottle because somebody 25 years ago said that hormone replacement therapy causes breast cancer for women, which was it's funny, a month ago, the FDA and all of the women's people met to argue about just this subject. And, somebody said somewhere that testosterone and hormone replacement for women was going to cause breast cancer, and now nobody wants to do it. And it absolutely doesn't. If anything, it prevents it. And osteoporosis and sexual dysfunction and chronic UTIs that women experience later in life. Pain.
Didn't
upon
Halle
intercourse.
Berry just came out right? Halle
They're all
Berry?
doing it.
She's like, yeah, or is it Jessica
Just
Alba?
on a lower dose than
Bro,
than-
it's one of the most
yeah.
famous, beautiful women on the planet. I can't remember which one, Jessica Alba or Halle Berry. I'm sorry if it.
It's a very low dose. Women
Yeah.
are not testosterone dominant. We're estrogen dominant. It's a
Mhm.
very low dose, but it's life changing.
Really life changing.
Yeah.
Oh.
Yeah.
Obviously, it's like we all joke that I'm a hypochondriac, but I feel like I'm constantly. I'm in
No.
I'm in constant communication with like
Your medical team.
medical professionals, and I hurt myself really bad in the Navy. I could not work out without blowing my back out, dude. It was so discouraging. I was like depressed. Like if you listen to the full series, there was a whole series about like how I kind of rehabilitated myself, right? Like mentally, spiritually, all
Mhm.
this shit. Obviously the diet, maybe I take for granted. I don't like kiss my own ass enough, but like there was a whole journey that I went through that I wanted to share with the listeners here for 2026. And the hormone therapy, like as a man for testosterone, dude, it's key. I mean, bro, if your hormones are fucked, you're not losing weight. I don't give a fuck what you're doing, bro. You're sore as fuck. Your muscles aren't working.
Mhm.
And and these are all complementary items to Eat Clean Bro. So if you're, if you're trying to look good, you're trying to move your body around, you do a little bit of TRT and you order Eat Clean Bro, dude, you're going to look fucking great.
Yeah.
You're
true.
going to look great. The protein's high. It's a grand slam.
Wow. If someone wants to get in contact with you, what is the best way?
So they can either call the office. I'm sure you guys are going to tag me here on Instagram. They can send me a message on Instagram, and then I can set them up with either being a telemedicine patient, or they can just call us and come in if they're local. I have guys drive from all over the country to come in and see me, whether they're traveling. Yeah.
Wow.
They come from all over. Ohio, recently it was Ohio, Albany, New York, Pennsylvania, Florida, Illinois.
Wow.
Some guys just like come here and walk in. They're like, where's the girl from TikTok?
I
I
No
need help."
way.
I made an
I'm like,
inappropriate
"All right,
joke
come in."
earlier with Vinay, right? And all like the procedures I did.
Yeah.
Tell them, like, you guys also administer pee shots, stuff like that. I never got one.
What was that?
I'm really scared. I never did it. And
What
Kayla,
is it?
Kayla told me I'm not allowed to do it. But
Tell me more.
pee shot. Use your imagination.
Oh, I don't know what you were saying.
Yeah,
I have no
P-
idea.
P.
Another PRP. I have no idea. You're saying all these terms. I have no idea what's going on. Oh, okay.
Yeah. What else? Like
Yeah,
the billboards,
so we do
right?
them. It's a stem cell transplant that's injected back into the penis. So an erection is only blood flow. If you think about it, you have two tubes on either side of your penis. They got to fill with blood to make an erection, and they have to close off to keep the erection. When you have high blood pressure, high cholesterol, and diabetes, just like the veins and arteries of your heart and your brain that cause a heart attack or a stroke, the veins and arteries of your penis fill up with plaque and don't work as well either. And this is what can cause erectile dysfunction.
Oh man.
See that?
Is that what happens?
Wow.
Yes.
See?
So with the P shot, when we do the stem cell transplant, it helps to flush that out. Now, with that being said, you also need to fix your health. You need to try get on testosterone, of course, to help with that. But also you need to fix the high blood pressure, the high cholesterol, and the diabetes. If you're going to continue to have your self-destructive ways, don't expect a good erection after all the treatments we have here.
And
Look at us educating our listeners.
yeah. And for those, for
They work
those,
great, though.
yeah, I would say for those with, right. So 2 things: you have high blood pressure, right? You're probably overweight. Being overweight, a lot of salt in your diet, that'll increase your blood pressure. You could bring it down within reason. Your cholesterol is a function of your liver. So, incorporate, like I was talking about, sauerkraut, ginger juice. Try to incorporate things into your body that are healthy for your liver and liver repair. So also like the raw garlic, I'm a big fan of too.
So back to your back pain and joint pain, testosterone, everybody freaks about estradiol and estrogen and testosterone. High estrogen is what gets rid of the joint pain and the arthritis. So like, I'm sure your back is better. It's not great. You have to still be careful.
Yeah, I have to be careful, and I'm
very
proactive with my range of motion. I'm actually
right.
deceivingly flexible because I work on it all the time.
He just told us before that he was doing karate kicks in his garage.
I don't know if that's such a good idea. Okay.
Yeah, nice and slow. Aren't you a karate person? Are you a karate person or no?
Me?
No.
No. No.
That's
Just
actually my
the
friend
gym,
Jen.
and
My friend
I
Jen
used to
does
be a big
karate.
runner, but I'm realizing now that running is just gonna make my back worse later. It's gonna make my knees worse later. So I've been doing just a lot of walking outside. The fresh air and the sunlight's so good for mental health. And then, if you're walking and getting your heart rate up above 100, you're gonna burn fat. That's
Yeah.
cool. I've lost more weight with weights and just walking than
running.
anything
Yeah.
else. Actually, body fat, not just so much
Yeah.
weight.
I love the weighted vest too.
Yes.
I walk with the weighted vest on.
Ruck? Is it a
Yeah.
ruck? I got one of those.
So can we talk about BPC 157? How do you feel about that
Technically,
one?
it's now been reclassified as pentadecapeptide, but
Oh.
more formerly known as BPC 157. Yeah, it's
Gotcha.
an amazing peptide for exactly what we have is back pain.
You're so smart, Jamie.
I'm not that smart.
You're spitting out all these terms. Yeah, I like it.
Why? To normal people, it's common.
Okay.
It's like you talking about the mortgage industry.
Oh, okay. All right, fine. All right.
Sorry.
Please explain, Vivian. Go
Yeah.
for it.
Tell them about some of the good benefits.
We all have peptides in our body and they're secreted all the time. When you take a peptide and inject it, it just asks your body to make it a little bit more. So for example, we'll call it BPC 157 because that's what it's more familiarly known as. It comes from your stomach, body protective compound 157. And when your stomach secretes this, it helps with inflammation, soft tissue injury, joint pain. If you have an old nagging injury, it'll really help to ease the pain. If you're post-surgical and you're looking to repair a little faster, it's going to get you there. You inject it 5 days a week. It's not time sensitive. You can do it in the morning or at night. It's a teeny tiny shot in your belly with a really small syringe.
Smaller
I feel
than
better in
hair.
about 5 days,
Really?
honestly. Yeah,
feel
I'll
better
usually
right
do a
away,
round of
but-
it. I'll do a round of it once a year, and then I'll leave a bottle in the fridge, and I'll mostly use it like Advil, so I can get ahead of my injury. So for people like me with higher blood pressure, I can't take Advil, Motrin because it hurts your kidneys, it makes your blood pressure high, and then it also puts you at a big risk of stomach ulcers. I put more patients on dialysis for taking a daily Advil than anything else. These people that have daily aches and pains and just pop an Advil and not think about it, you're destroying your kidneys.
So I should stop taking Advil?
Correct. You should not be taking chronic Advil. No.
You know what I'm a big fan of? And I tell everybody this, if you have aches and pains, fucking Epsom salt bath, dude. It's so, dude, the mineral, get the magnesium mineral salts, dump the whole bag in there, do the whole 8-pound bag in your
Oh
bathtub.
God, you're crazy.
Fucking salt the shit out of yourself, man. Reverse
Oh my God.
osmosis.
This is not
Amazing.
medical information, please.
You could do
A
20
regular
minutes.
old baker's cup is fine, but
I have the jumbo bathtub because I'm enormous.
Uh-huh.
So
You
yeah,
throw the whole bag in there?
I stopped, dude. I will never take I don't take Tylenol or Advil anymore,
Mhm.
like no matter what, because the
Tylenol's
supposed to
rough
be-
on your liver.
it's supposed to be
big
really
time.
disruptive to your gut health or something.
I gotta
Yeah.
stop.
I can't remember why I stopped, but this
You're
is
not
all
wrong in doing that. Honestly,
Yeah,
it's not. But again, you can go and get these things freely at the pharmacy, and nobody's doing anything about it, you know. But like, oh, testosterone's bad.
Yeah.
Think about what I said. I put people on dialysis daily for taking just regular old Advil.
So this is what I do. I have a 4-ounce ginger shot every day, 6 days a week. If I miss a week, like when I go on vacation or something, but in Aruba, there's the juice bar
Yeah,
at the
there-
Hyatt,
yeah,
so
Yes,
I was
there
hitting
is.
ginger
Uh-huh.
shots like
Were you
crazy.
down by the high rises?
Yeah,
Yep.
Yep.
and the ginger shot is my go-to painkiller, and it feels fucking great, and it's good for your liver. So
Good for inflammation. Yeah.
yeah, I'm all about it. So I wanted to take like a full educational 360 approach on this. I showcased a few of my friends that I do business with,
Mm-hmm.
and I was trying to just provide as much information for people going into the new year to give them like, listen, dude, if you really want to grab the bull by the horns,
Yeah.
here's
At least take 2 out of the 5. You can just say, "Oh, I'm going to try these
Listen,
couple of things."
you know,
That's
here's
it.
here's a fucking roster of some animal shit you can really be your best self. Like
rock
if you,
stars.
you really want to hit your goals and you
Yeah.
want to take a full 365-day approach to like looking real fucking good.
It's almost like an all-star team. You just got to pick what you want to do and don't overwhelm yourself. Just do a couple of things, start slow, and
Yeah.
then you'll realize when you do these couple of things, you feel better. You'll then go to the other 2 things. That's really what it is.
Yeah.
And we gave you all the information to do it.
And the people, the
Yeah,
face,
correct.
they put the face to the business. So,
Yeah.
you know, I do the CJC, which is like the growth peptide. I'm probably gonna get hardcore in January. I know the holidays are coming. I'll probably hit that until it runs out, which will like crazy sleep, burns fat, and
Mhm.
do like the BPC with it. And yeah, TRT. That's what I'll be doing in January, which is like a pretty safe, normal therapeutic thing.
Mm-hmm.
And then, like I told you, I have my buddies that help with the injuries, the
Yeah.
spine doctor and the
Yeah.
orthopedic
It's a
surgeon.
lot of people.
So I think we're ready. We're ready to go, right? We're
Yeah.
gonna have a great 2026. You got anything fun and exciting over at Elevate Male Wellness for 2026?
Oh gosh, we've been so freaking busy. It's been
Yeah.
insane. I mean, listen, for guys that are afraid about testosterone, you can always start a peptide first. Typically, they last anywhere from 2 to 3 months. That's, safe. Like you were saying, the growth hormone peptides, they're great for burning belly fat, building lean muscle mass. You'll sleep like a baby. It's good for collagen synthesis, so it strengthens your ligaments and tendons. Good for hair, skin, and nails. A lot of guys say it helps with libido. So that's a short course of something you can do for 3 months. And if you have nice results with that, that's when guys like get their beak wet and they're like, you know what, let me try a little testosterone. So another thing with testosterone too, that I want to mention is that I always tell guys, give it 4 seasons, give it a full year. It really takes 4 to 6 months to see like full, like lowering of blood pressure, lowering of cholesterol, the body fat starting to go away. I mean, it didn't take you 2 months, 3 months to get here. It's not going to take 2 or 3 months to get you out of the woods. So give it 4 seasons. But if it doesn't work out for you, or it's something that you don't want to do, or you decided you don't want to do it, you can stop and your body recognizes you're not taking it anymore. And you'll go back to wherever you're supposed to be at that point in your life. This doesn't ruin you for good. There's so many, the Reddit professors go crazy, like, oh, it's going to ruin your fertility. It's going to shut you down. And you're never going to make anything for, anymore. And you're never going to make testosterone anymore. That is the furthest thing from the truth. I've had guys that have abused all kinds of crazy things for years and years and years. And then they get a scary bill of health from a doctor and they quit. A year later, somehow they end up in my office. Everything's back. They just don't feel well because they're used to being on rocket fuel.
Yeah.
So,
That's the thing that's scary about it is like people abuse it.
Yeah.
So,
but that's with anything.
There's a therapeutic range. You want that's what you want. You're doing this for health and wellness, not like.
And that's why you go to a professional and they keep you within the range. You don't just go and go full force.
Go fucking crazy.
Yeah.
More is
ripping
not
your
more
shirt
with
off,
it.
screaming Hulkamania.
No, more is going to make your penis stop working and give you really high blood pressure, and you're not going to sleep, and you're going to be anxious, and you're going to be bright red with a headache. Like your
You
bank
heard that,
account
listeners?
isn't bigger because you're on more testosterone at all. It's worse.
I was so happy to have you on, Viv. I have to come in soon and see you.
Just
Come
show
see
up
the-
if you're
come
up here. I mean, if you want to call on your way, that's fine.
Maybe
but-
I'm coming again. I'm coming with you.
Yeah.
I'm going to a lot of places in the next 30 days.
Wow. Wow, bro. I'm about to have you
I'm
feeling
going to
like
be on tour.
I'm about to make you feel like $1 million.
The website's elevatewellnessgroup.com. If anybody wants to check it out, they can actually sign up there and get a free phone call from my office that tells them how everything works. And then we just send them the information. If they want to start, they can.
Okay.
Wow.
Awesome.
Yeah. Isn't she great?
Awesome. Very, very educational. I
Yeah.
enjoyed it.
Tell Gil I said
Pretty
hi.
cool.
Yes.
Tell him
I
we
will.
killed it.
Thanks for having me. Am I
Yeah.
signing off, or are you signing off?
We got Charles and Dylan over here. They'll sign
We
it
were
off.
going to say bye and happy holidays and thank you again for coming
Merry
on.
Christmas, Happy
Merry
New
Christmas.
Year's,
Yeah,
guys.
definitely. Bye.
Thank you, Viv. I'll see you.
Bye.
Thank you for everything.